Hello. Right now we will talk about speculum examination and cervical smear. You can see that we are having two parts, speculum examination and cervical smear. So they are actually two things. And this speculum examination can appear to me in the exam as a teaching station to teach medical student about speculum examinations regarding its indications, its contraindications, and how to do it. And it can appear also as examination, maybe associated with cervical smear or maybe alone. We need to go for this speculum examination and cervical smear in different situations. Like, for example, when we are having a patient coming to me and she's having unusual discharge, or she's having unusual bleeding out, or she has been invited to do routine cervical screening test, for example, or when she is having any pain down below there and you need to do speculum examination. Okay? All right. And to have mind map about this speculum examination and cervical smear, you need to know your tools and you need to know your steps. But before going to know about our tools and our steps of doing the speculum examination and cervical smear, we need to have some discussion firstly about how to explain this for our patient. Okay? All right. So after finishing taking our history in the station, we will thank our patient as usual and we'll explain for her that, Mr. X, thank you for answering my questions. Right now, I'd like to examine you. I'd like to check your vitals. And I'd like to examine, are we having any something else here related to any patient who is coming to me and having unusual down below discharge or bleeding or something else to verbalize about examination with the speculum and cervical smear? Yes. We need to examine the patient tummy. We will not do this, but we will verbalize about this. So we would like to check your vitals, examine your tummy, and do a speculum examination. And if you are asked to do cervical smear, you can also do cervical smear examination, verbalize about this. We would like also to take a sample from the wall of your birth canal. Is that will be okay? Okay. For the purpose of doing this speculum examination and doing this cervical screening test, I would like you to expose yourself from below your breast till down below. And we will do this while you are laying on your back with bringing both of your heels towards your bottom with folding your knees both sides, which we are calling it modified lithotomy position. I will have a look around the private area and I will also insert a speculum, which could be plastic tool like this or metal tool like this into the speculum to have a look. And after this, we will insert a brush. If we have been asked to do cervical screening, we will insert a brush to take a sample from the cell lining of your birth canal. It shouldn't be painful, but it could be a little bit uncomfortable at any time. If you feel any pain, please let me know. I will stop. We will ensure your privacy and I will have a chaperone with me. Shall I proceed? Okay. But just before starting, you can let your patient go to empty her bladder if she wants. And also, you can try to rule out some contraindications of speculum and cervical smears, like, for example, if she's having pain, if she's having any active bleeding right now, also one. If she is in her late pregnancy, third trimester, also one of contraindications. If she used any spermicidal gel, especially in the last 24 hours, so this is also one of contraindications to go for this. Okay? All right. And it is important to rule out these contraindications if you are in teaching stations exactly. But here in the procedures station, you can, just before starting business, by any chance, did you use any spermicidal gel recently in the last 24 hours? And by the history question, you rule out any active bleeding right now, you rule out pregnancy, especially in the last third trimester. All right? Then you will start to gather your tools. So excuse me, please, just some moments. I will pick my tools and we'll start. Okay? So right now we will start to talk about tools of speculum and cervical smear. Regarding tools of speculum and cervical smear, you will need gloves, you will need gel, you will need the speculum, and we are having two types, one disposable plastic one and one metal non-disposable. And you can have either one of these in your exam, and you need paper towels, and you need this endocervical swab brush if you have been asked to do cervical smear, and you need container for the sample, and we are having two containers, one called shore path and one called SimPrep. I mean by shore path and SimPrep that there are two ways to get the cervical smear sample. One by using container called SimPrep method container, and one by using container called shore path container. And the difference between them is regarding the last step after getting the sample, how to put this sample in the container. If we follow special way called shore path, so we have used right now shore path technique to get our sample. If we used SimPrep technique, so right now we have used SimPrep container to get our sample. So ideally, these are my tools that I can use them to do speculum examination or cervical smear. And I hope this point of this endocervical brush right now is crystal clear for you, and both speculums like this. The most important way about the speculum is this is the screw of the speculum that we are looking the speculum with, and the second, how to hold the speculum. Ideally, try to hold this speculum by this way, like this. You are putting, before starting to do your examination, this is the ideal way to hold the speculum, either the metal one or either the plastic one, to hold it like this. I hope this point is clear for you, right? To hold it like this, okay? And we will see together while we are using either the metal or the plastic one, how we are inserting it and what are the steps of doing our speculum examination and getting cervical sample. And take care about these screws that we are using them to look. These screws, we are getting them in a clockwise, we are rotating them in a clockwise like this to lock the speculum, and we are opening it anti-clockwise to close it again. All right? We will talk about the steps of speculum examination and cervical smear. But before moving to these steps, some points to take care about in your mind. Firstly, that the ideal position for you is that you should have a chair and sitting on this chair. And you should also have good light source. And I told you, if you wish to advise your patient to empty her bladder, she can do this. Mrs., would you please empty your bladder for me before starting our procedures? Okay. Then you can verbalize about, I'd like ideally also to wash my hand before wearing the gloves, it will be all right. Then you will start to expose your patient while she is in her modified lysotomy position. Gently like this. You are sitting on the chair right now, and you are having a good light source, okay? Before starting to do the speculum examination, and we have ruled out the contraindications, we should have a look firstly. Have a look for any signs of inflammations, have a look for any swelling, have a look for any discharge coming out, having a look for any cyst. And if you would like also to ask your patient to cough for you, it will be okay. Would you please cough for me to see if there are any prolapse, vaginal prolapse, I mean, or not. Okay, so firstly, we will start to have a look for any abnormality, and we'll ask our patient also to cough for me. Okay? And a gentle reminder for you just while we are doing is that we have verbalized about observations and we have verbalized about the abdominal examination for our patient, but we didn't do this. So after having a look and after asking my patient to cough for me, right now I will come to the point of the speculum examination. You should firstly pick the speculum, either the disposable plastic one or the metal one. And recently the metal one is one which is frequently appearing in the exam. And I told you about the ideal way to hold it like this. While he is closed, it is closed right now, it is closed, this speculum is closed right now, and ideally you should pick it like this. before starting to pick it, we are lubricating this speculum. However, a very minor scientific tip here about lubricating the speculum, that ideally if you are about to do a cervical screening test, taking a sample it is advisable not to lubricate the tip to avoid the contamination of the samples that you will take. And they are also advised to use special types of gel. Okay? And so this lubrication ideally should be avoided if you are about to take a sample. But if you should use lubricating gel, try to avoid the tip. And there are special types. There are special types of gel you can use it just to lubricate these sides here. These sides here. Okay? To lubricate these sides here. Okay. And also to lubricate these sides. Okay? What? I even, while you are, if you want to just furtherly explain to your patient about the detailed cervical screening while you are explaining for her the procedure, it will be all right. I just simply explained for her, I will have a look around the private area and I will insert this device called the Speculum to have a look around the Percy canal, and we will insert this brush also to take a sample from your Percy canal to examine it under microscopy. As we are trying to find out if there is any HPV virus there, which is responsible for cervical cancer, and also if there are any abnormal cells in the cytology or not. If you want to explain these first details for your patient before starting, it will be all right. If you didn't want, and just simply explain for her that you will put this device and have a look around the Percy canal, and you will take a sample from the cell line to examine it under microscopy to see if there are any virus or abnormal cells, it will be all right. So right now, we are lubricating it, we are holding it right now. How we are putting this? We are trying to separate both LP right now by my non-dominant hand like this. And let the patient know before doing it, Mrs., I'm about right now to put the speculum. Shall I proceed? Is it okay? Or if you even didn't want to take a consent from her about this, just it will be enough to say, I'm about right now to insert the speculum. You will separate both LP like this by my non-dominant hand. Okay? Then you will start to put it. We are putting it by side like this. So we are not putting it like this. No, we are inserting it by side like this. Then we are inserting it. Okay? Inserting it closed. Inserting it closed like this. Inserting it closed. Inserting it closed. Then, after inserting it closed, we are rotating it 90 degrees to be like this. Still closed. Still closed. So right now, I am in. If you want to put it to the opposite direction, to rotate it downward, it will be right. But which is better is to make it like this. Right now, the speculum is closed and we'd like to open it. We should open this screw. And we will open it. After losing this screw, right now, we can open it. And you can right now see, by pressing over this blade, you are opening the speculum. By pressing over this blade. After opening it, we will close again this screw like this to maintain the speculum open. Right now, the speculum is opening and I can totally visualize the Percy canal of my patient. These are the steps of the speculum examination. If I'm about to do also cervical screening and take a swab using this endocervical brush, I can tell my patient after just having a look to see if there any prolapse, if there any bleeding, if there any discharge. We can tell your patient, Mrs. right now I'm about to put this brush to take a sample from the cell lining of the cervix. Is it okay? Yeah. How to put this brush to get your sample? We are putting this brush like this. Mrs., we are about right now to put the brush to get the sample. We are letting our patient to know about what we are doing, and we are putting the brush like this. The ideal way to get your sample is to rotate this brush 5 times, 360 degrees. 1, 2, 3, 4, 5. Then you will take the brush out. Right now I have finished taking the sample, Mrs. And you will put it in this liquid-based container. And I told you we are having 2 ways in this cervical smear. Way called SimBrib technique and way called sure pass technique. And the difference is that after getting the sample, if you are about to have this container of SimBrib, we are just like hitting this brush in the SimBrib container 10 times. 10 times to let any cell lining to fall down in the container. We are naming this way SimBrib technique way to get the sample. How to put it? Just we will open the container and put the brush like this and hit this brush 10 times at the base of the container. 1, 2, 3, 4, 5, 6, 7, 10 times to let the cell lining fall down. The different technique way to get the sample after taking it from the cell lining is naming sure pass. Sure pass is a container cup like this with a hole on its top. You will put the top of the brush, this white part I mean, through the hole, and after putting it through the hole, you will rotate the brush like this. By making this rotation, you will let this white part fall down here into the container. So we are naming, fall into here, the container, we are naming this as a sure pass technique. And it will be crystal clear in your exam which container you are having. Are you having the SimBrib container? So you will hit the brush 10 times at the base of the container, or you are having the sure pass container, so you will put it through the hole on the top like this, you will rotate the brush like this, so this white upper part will fall down into the container. Alright? And definitely we are trying to ensure that all equipments we are having are within their expiry date. After taking the sample, right now, Mrs., we are about, it is almost done. We have finished taking our sample and examinations. I will take the speculum out. Then you will reopen this speculum again. Okay? You will take it slightly out. You will not close it. You will not close it. You will not close it. Take it slightly out. I didn't close it right now. Okay? Then you will just try to half close it. Half close after taking it out, half close, and then you will rotate it like this as you have inserted it. Then you will totally close it before moving out, totally close it, and you will take it out. You will have a look on it to see if there any discharge, if there any bleeding there or no. Then you will thank your patient. If it is disposable, you will put it in waste bin. If it is not disposable, you will put it on site. It will be sterilized again. So the trick here is that while I am taking the speculum out, I shouldn't close it until I just swab it or tract it like this for some inches. And we can make it half closure after this until we are about to take it out. We will close it while we are about to take it out. Why we didn't close it while we are in? If you have closed this speculum while you are still in, this could make a traction on the cervix. It will be severely painful. So we are trying to close, we are trying to avoid closing the speculum while we are in. Just we are taking it out slightly for 1 inch, maybe 1 inch, 2 inch. Make half closure, then we will rotate it, and take it 1 inch more. We can close it just when we are about to take it out. Completely close it when we are about to take it out. All right? All right. Then you will take this way. Thank you, patient. Thank you, Mrs. We have almost done. And just we can clean this part and ask our patient to dress himself up again. You can let her know that she can experience some bleeding after doing this speculum examination, and you will label the sample of your patient and then discuss with her the waiting time for her sample, nearly average time from 2 to 4 weeks. Sometimes it takes 3 weeks to get back, or maximum 4 weeks. Sometimes you will discuss with her the waiting time for this, and you will take off your gloves, and then you will go and wash your hand again and thank your exam. And you will discuss the definitive management. Depend on the situations that you are in, and you are taking this sample, for example, or you are doing this speculum examination, for example. I hope this point is crystal clear.